All right. Okay. So welcome everybody for this webinar organized within the frame of the LIDISKI project. My name is Arnaud Bataille. I'm a virologist at CIRAD, and I'm the coordinator, one of the coordinator of the LIDISKI project. First of all, I would like to give a big thank to our partner ICORE, and especially to Gilles Tomilawal for organizing this webinar for the project. So today our webinar will be about engaging communities in disease reporting with a couple of talks and then time for discussion. So just quickly to show you, I think within 1 hour we should be done. After this welcoming remarks, I'll give a brief overview of the LIDISKI project, and then we'll have the first talk by Dr. Benga Ario of ICORE, and then a second talk by Dr. Garba, before having around 20 minutes for comments and questions. So really the objectives of this webinar is to showcase the efforts of community animal health workers on the LIDISKI project in disease reporting, see what's their role in here, and to highlight also the role of state and other parastatal agents in timely investigation of disease suspicions, notably those presented by the community animal health workers. And then like from here, of course, try to have an advocacy to show here that there's an interest in adopting the methodology proposed in the LIDISKI project for integrating community animal health workers in disease reporting, and have this adoption in other states in Nigeria, but also potentially in other countries. All right, so I'll first start with giving you an overview of the LIDISKI project. So LIDISKI stands for EU supports LIDISKI disease surveillance, livestock disease surveillance knowledge integration. It's a project about 2 diseases with 4 partners that's going for 5 years until 2024, and really about 4 actions. So the overall objective of the project is integrating the knowledge collected from actors in the animal health sector to provide tools and know-how to implement sustainable surveillance and control strategies against 2 livestock diseases: peste des petits ruminants, PPR, in sheep and goats, and Newcastle disease in poultry. So here on this project, we are focusing in one country, in Nigeria. Of course, we cannot work everywhere in Nigeria because it's such a huge and complex country. We are focusing on 2 or 3 states with 4 partners in total. Our partners in Nigeria are the National Veterinary Research Institute, NVRI, and ICORE. And we have 2 partners from Europe, CIRAD here as coordinator, and the IZSV as expert for Newcastle disease. So the actions of the project are divided in 4 parts. We have one is focusing on capacity building of animal health actors, and another one is about engaging the communities in surveillance and control. And third one is about increasing our understanding of the epidemiological and socioeconomic context of the transmission of both diseases. So all this kind of better capacity and engagement and understanding leads to the development of tools and guidelines and scale-up strategies. So the target group for this project is, as I said, the animal health actors. So it means public and private vets, the community animal health workers, the livestock owners, vaccine producers and suppliers, and with as final beneficiaries, the smallholders and livestock owners. We have multiple associates to this project, with the Federal Ministry of Agriculture, with the World Organization for Animal Health, the Amadou Bello University, and in the International Livestock Research Institutes, among others. So the expected impacts of the project are, in terms of building capacity, as I said, we're working on 3 states: the Strait of Plateau, Bauchi, and Kano in Nigeria. So having a strong capacity to control diseases in these 3 states, and especially of different animal health actors, such as the National Veterinary Research Institutes, notably for vaccine productions and delivery, and for disease reporting and investigation. We hope to provide evidence for the epidemiology of both diseases, and also to have a better understanding of the perception of these diseases in the community, and about the vaccination cost benefits and the impact of climate events in the livelihood of the livestock owners. We hope to develop tools and guidelines that will be used to design and scale up locally adapted strategies for the surveillance and control of PPR and Newcastle disease. Another quite key component of the project is to install solar power at the National Veterinary Institute and at its host station to improve vaccine production and delivery, and diagnosis and reporting. An important impact also is to empower field actors that will be kind of champions in disease surveillance and controls in the communities, with a link with a target of having 70% of the smallholder livestock farmers in the targeted areas of the project directly benefiting from the improved access to vaccine and animal health services. So that's the overview of the project. Here we are really focusing on one specific component of the project, which is really the work with the community animal health workers, and as we are seeing them as key components to reach the communities for disease surveillance and control. So in collaboration with the states, the project has been building the capacity of the active community animal health workers and vaccinators in raising awareness for PPR and Newcastle disease, in delivering vaccines to the farmers for prevention of the diseases, and serving as surveillance agent for the livestock diseases. And here we'll hear about the methodology put in place during the project, but also by other projects in Nigeria, and start discussing on how to move forward from there. So here I will leave the floor to our first speaker, Dr. Benga. How are you? Please.
I'm very fine.
Yes, we can hear you.
Yes. Hi, Arnold. Hi, everyone. It's nice to be here. So let me share my screen. So I'll be talking about improving the rural veterinary healthcare system through the community animal health workers network. And it is majorly on the method, how we actually approach this. So my name is Benga Rio. I'm the livestock lead for ICORE and the technical advisor for this project, LIDISKI for ICORE. Basically, these are the outline of my presentation. I'll be talking about the pillar, the gap, the work package 3, the expectation of the community animal workers, the approach and methodology, the market linkages, up to challenges and the recommendations that we'll be recommending going forward. First of all, I want to talk about the pillars. The project is built around 4 pillars, which include capacity building, engagement, understanding, and developing, just like developing of tools and guidelines, just like Arnold had mentioned earlier on. And all of them actually inform the basis for the 11 work packages that we worked on the project. And this presentation is actually speaking to the work package 3. We must also note that the project is implemented in 3 states, and it focuses on two major diseases of socioeconomic importance that are very common in the rural communities. These are the Newcastle disease and PPR disease. Prior to implementation, we identified various gaps in the rural veterinary healthcare system, which include little or no access to affordable veterinary services, lack of access to veterinary inputs such as drugs, vaccines, and other products, and poor awareness about the availability of animal vaccines, especially the Newcastle disease vaccine and the PPR vaccine, and the poor knowledge about the major diseases such as the Newcastle disease and PPR. And then we also noticed the poor surveillance and reporting system within the rural, from the rural community. Now, the work package 3 was built around identifying and resolving the gap that has been identified. And then what strategy did we actually use to fill up this gap? It was actually the community animal workers program. And as I said, the work package 3 was designed to build the capacity of field actors in disease surveillance and the control of good practices. The objectives are to facilitate the training of trainers, facilitate community animal workers training, activate state supervision of community animal health workers. It is expected that the community animal network will actually strengthen at the end of the project, we strengthen the veterinary service delivery. It also strengthen the veterinary input delivery system. It also bring about awareness of the Newcastle disease and the PPR disease. And it will also bring about the awareness about animal vaccines, and also improve the adoption of animal vaccines among the rural smallholder farmers. And we also expect that it will also improve the availability of ND and PPR and other vaccines that have been sold by distributors. And on the long run, it will also improve disease reporting and surveillance in the rural communities. One of the methodologies that we used was the institutional and stakeholder engagement. This actually involves collaboration with states and VCN, and to activate the start of the community animal health workers. And as we all know, the VCN is the statutory body for veterinary practice in Nigeria, while the state was actually the implementer of the community animal health workers. And another activity that we also do around stakeholder engagement was also community engagement, which is actually to inform communities about the project and also about the community animal health workers. And other thing was also to create advocacy around planned activities within these communities. Another part of this engagement was also about private sector engagement, because we realized that private sector engagement is actually important in ensuring that demand and supply works within rural context. So private sector is quite very important for the project. So one other approach was in the selection and training of the trainers. The states were involved, fully in charge of selecting the trainers, and having selected desk officer for the project in each of the states. Each state selected the trainers and then invited VCN to actually train these selected trainers, who are actually veterinary doctors. They actually include the NBRI staff, some state vet staff, and private veterinarians. So the last one was also around the community animal workers training, the assessment, and the certification. So what happened was that the state actually had an in-class training for the community animal workers, practical session, and attachment of each of these community animals to veterinary clinics within local government area based on their state. And this actually took place for three weeks. And then we also actually the state also made use of the VCN curriculum. Another thing was that the revision and the assessment of this community animal worker was done by VCN, and few weeks later, after VCN had marked this assessment and were sure that the community animal worker knew what they were going to do on the field, they came in and then gave them certificates. And then to support their field activities, LIDISKI actually provided the community animal workers with ambulatory kits and also mobile devices to actually help them in disease reporting. Now, the hallmark of the community animal health worker, which remains what the project was all about, was to ensure that state was in charge of supervising the community animal health worker. It was important that the community animal workers are not left on the field alone just to provide services without proper supervision. These supervisors were actually there to provide on-field and off-field support to the community animal health worker. And whenever the community animal health worker get to a point where there are some services based on VCN's recommendation that they cannot do, they have to refer these cases to their supervisor. So those were very important reasons that the supervisors were quite mandatory for the program. Now, coming to market linkage and visibility, one thing that we also did was that, having understood that the private sector have a major role, we had partnership with three major organization in distributing veterinary products and especially vaccines to rural retailers who have the capacity to actually do this. And during the assessment, this set of important value chain actors were actually introduced to the community animal health workers to facilitate exchange of to facilitate demand and supply of veterinary products like vaccines and drugs. And then one thing that we also did again was to help the community animal worker create visibility for their services in the community, in the various community, and also to show that, okay, what we're actually doing in various communities. So we printed banners for the community animal workers, which have their names and contact number for farmers to reach out to them. And one important part of this is that we also realized that a lot of the community animal workers have actually graduated from not being just community animal workers to being retailers in their various rural communities. And so other community animal workers are actually reaching out to them to also buy products. So they have their own agrovet shops. Now, in terms of market activation is actually all about creating demand, either for services, either for products, either for activity surrounding the community animal worker or the project. So what we did was to increase demand for the services of community animal through the use of a sensitization campaign and vaccination campaign, which the purpose of this was to actually increase the demand and the adoption of community animal worker and vaccine respectively at the various rural communities. And then we also made use of IEC materials such as posters, flyers to reach out to rural farmers, and we also made use of radio jingles to reach rural farmers, because we also realized that most of the farmers actually in our implementation state make use of radio to actually listen to various various information. So we use this medium to actually reach out to farmers to create awareness about the PPR disease and the Newcastle disease and the availability of vaccines at NVRI through the community animal health worker. We also use that medium to show how the community can actually access these community animal health workers. Now, in terms of disease reporting, as I said earlier on, we provided Android phones for the community animal health workers. And these Android phones were actually a Covo Collect device was inputted into this phone, and various forms for disease reporting and vaccination reports were actually designed to so that they can use this when they are engaging with the farmers, and so that as they are putting this report on this form, at real time, the project can actually see what is actually going on the field. And they also make use of this medium to actually send in out information about outbreaks in various regions. And the good thing about this was that it can be used offline and online, so that anytime they have access to internet, for those offline, they can now send this report once they have access to internet. And all these reports on a weekly basis, on a monthly basis, were all presented to the state or every week and almost every month. And in terms of impact, over 138 community animal health workers have been trained. We've partnered with 3 distributors of veterinary products, and we have activated over 15 rural and peri-urban distributors. And then over the period of the project, over 31,000 farmers have made use of, have been reached with the PPR vaccine, and over 56,000 farmers have been reached with the Newcastle disease vaccine, which are both produced by NVRI, and NVRI being part of one of the implementing partners of this project. And in terms of income, the community animal health workers have made a lot of income around vaccination and also providing veterinary services at the rural area, which is as indicated in this place. And we've also seen various ranks of the various services provided by the community animal health worker. If you go down, this roadmap actually shows what we have been doing from the inception phase up to the present moment within the project. Another important impact of the project is also around the disease reporting system. Over the years, we have seen increase in the reporting system, the involvement of community animal worker in actually trying to make sure they report, because it's actually not been easy since 2021. We had just 701 reports. By 2022, it has increased, and within this year, just now, it has risen so high. So we can see the reporting system has actually improved. And we've also realized that in terms of vaccination adoption, over 80% of the farmers have adopted the use of vaccine and have accepted it. So another part of it is also around what type of cases are they managing. So we realize that vaccination services takes the most prominence. So that means that farmers are actually seeing that it is important to protect their animal rather than to go ahead treating them. So, and that means they also have they are beginning to see there's increase in the awareness level for vaccination of animals in the rural communities. We also see, we can see helminthiosis, ND, PPR, some of the cases that most cases that they manage. Then in terms of when you look at the vaccination level, we also realize that 21.7% of the vaccination done was on PPR, 20.1% was majorly on Newcastle disease, whereas the others takes 58.2%, and others in terms of CBPP, anti-rabies vaccination, anthrax spore vaccination, fowl pox vaccination, black water vaccination etc. And this have been the way this report has been gotten based on the report they've been sending using the technology of Kobo Collect. And in terms of challenges, we faced some challenges over the years, and we have noticed these are some of the challenges that we have seen. In terms of state ownership of the community animal worker, we realize that states need to own the program. VCN has done well to have the community animal workers program in as part of their program. And LIDISKI have also done well in adopting this program, working with VCN to ensure that we go in line with the way VCN wants us to do this, and so in so doing, allowing us to actually strengthen the institution. So it is important that the state actually take ownership of this. So the state, one way or the other, have been relaxing a little bit, but then, and this is also around proper supervision of community animal worker, and then mandating the reporting of the community animal health worker and the usage of report from the CHW, because we realize that the state is very important. They're a key they are a key decision maker at the state level. And we also realize that also the low recognition of the community animal worker, one way or the other, the community animal worker needs to be placed within the animal health healthcare system as part of the actors that are actually providing veterinary services at the rural area and rural communities rather. Insecurity is also another major issue, because there are a lot of situations where community animal health workers, even though they are resident within communities that have security issues, but they are unable to get access to input during security tensions in their localities. Another issue is also about the impact of the economic changes on the cost of input, especially vaccine. We've seen a lot, almost 50% to 100% increment in vaccine cost. And this actually on the long run have impact on the rural farmers who are accessing this, who these vaccines are being delivered to on the long run. Another one is also about access to input by distributors and retailers. Even though there is there is over almost 80% to 90% in terms of supply of vaccine, but still there's still higher demand of product by distributors and retailers, because they still cannot meet up their demand. So in terms of recommendation, what we are actually recommending is that the state needs to include the community animal worker as part of its state animal healthcare system actors. They are very, very important, because most of the disease that is being encountered, animal disease encountered, are majorly from the rural area, and majority of the livestock are within the rural setting. So outbreak generally emanates from the rural sector. So the community animal health workers are very important in this value chain. So another thing is about incentivization. Now, incentivization of the community animal health worker is not just about giving them money. No, it's not about giving them money, but another very important part of it is involving the community animal worker in state activities, something around vaccination campaign. Because take it or leave it, the network of veterinarians in Nigeria is not much, and it is with these community animal workers who can serve as foot soldiers to reach rural communities. Nigeria has a role in actually stopping PPR disease in Nigeria, and if the community animal workers are not made use of, it will be hard for us to actually achieve this mandate, and this includes for Newcastle disease and other diseases too. And another thing is budget creation. So it is not that the state needs to create budget and then be giving out money to community animal workers. No, but then state needs to see the importance of disease surveillance and reporting And therefore there is need for a budget for this at the state level, so that once this budget is there, then the state can use this budget to either monitor the activities of the community animal worker and then possibly provide some support for them when they are needing it. And then when referrals come in from community animal worker, they can use this budget to actually work on this. And if there is also disease outbreak that is being reported by community animal worker, they can actually make some of these funds to make sure of this fund to actually to actually do something around to investigate these diseases. And then another part is also state needs to engage the desk officer more so on disease reporting. So the state have a desk officer. So this desk officer's role is to ensure that the activities of the community animal workers continues to go on. So the state need to engage with the desk officer to ensure that the desk officer at every time is on the job to ensure that the community animal workers are doing what they're supposed to do based on VCN's recommendation and based on what the state wants. So another recommendation is need to make use of report by the for investigating outbreak. There's no need sending a report and then not make use of it. It is important for the state to pick this up and then investigate this outbreak, because these are tools, these are important information to make important decisions at the state level. Another important part of it is investment in improving logistics and cold chain storage for community animal worker. There is need for the state, for the community animal worker to invest in all these things to ensure that so that it will also lessen the burden of logistics on the community animal worker. And then there's need for refresher training, continuous training for the community animal health worker. Thank you for listening.
Thank you very much, Manga, for your very thorough presentation. Without further delay, we'll move to the presentation by Dr. Garba, and then we'll have some time for questions and discussion. So please, Dr. Garba, please share your screen.
Thank you very much, host. Good day, everyone. I want to thank Ikore and LIDISKI for giving me this opportunity to express the good work of Kano State Agropastoral Development Project. My paper title is Challenges and Solutions on KSADP Program. That is KSADP Community Animal Health Program. The Kano State government through the federal government of Nigeria received funding from Islamic Development Bank and partners with LLF, that is Life and Livelihood, for the implementation of Kano State Agropastoral Development Project, known as KSADP. The aim of the project is to address key issues, which include transhumance, agricultural productivity, increase in income to farmers, more especially in rural areas. It is expected that 15% of rural population in the state, or about 1,260,000 people, will be direct beneficiaries of the project. The KSADP Community Animal Health Workers was formed by the project in order to solve issues of animal health problems in the state. KSADP recruited about 220 community animal health workers, mostly youth, men and women. The 220 community animal health workers recruited are trained under the project and equipped with starter packs containing basic equipment and drugs to enable them deliver basic animal health services in their localities. The aims of KSADP Community Animal Health Worker is to make a living by selling of their livestock services and to become self-reliant individuals. In return for such services, they will be charged fees to replenish their stock and make a living. These are some of the pictures of our community animal health workers during the launching by the former governor of the state, Dr. Abdullahi Umar Ganduje. These are some of the starter kits which were given to each and every community health workers free of charge by the project. Currently, the community animal health workers in Kano State, they are assisting the Kano State government in vaccinating livestock, especially cattle, sheep, and goats for diseases such as two major diseases, PPR and CBPP. So the community animal health workers of the project were well kitted with overall dresses, lab coats, boots, facing caps, t-shirts, and so on and so forth. So they are going around with state ministry officials in vaccinating animals. And the vaccination is being supported by Kano State Agropastoral Development Project, whereby about over 2 million livestock were being vaccinated since the inception of the project. The system of reporting, or our strategy for reporting, even though we don't have much reporting system, because the project is engaged in solving so many issues of agriculture in the state. So first of all, we know that we make sure that our community animal health workers are using their cell phones whenever there is a disease to report to the local veterinary offices. Sometimes they write a letter to the offices, especially in a severe case. The third one, they use any available transport means. That is, sometimes they trek to go and report a disease. Number 4, they use infected animal sample specimen for reporting, because we gave them so many equipment so that they can take samples of a sick animal and take it to our laboratory in Gwale Veterinary Hospital, where this the project built multi-million naira laboratory. And in that laboratory, we also test some certain, most of our vaccine that we procure from MVRL for CBPP and PPR for their quality. And sometimes these community animals health workers, they come directly to our office, that is the KSADP, and report any trouble disease, whereby we take action immediately. So our project also, animal diseases are reported through this. These are some of the channels that our people are reporting diseases. 1, through local government. 2, through zonal offices. From zonal offices, they report it to the state. And finally, the state, if the case is severe, they report it to Federal Ministry of Agriculture and Natural Resources. So these are some of the challenges facing our community animal health workers. Inadequate and instability of funding to livestock extension agents, especially community animal health workers. You know, in Nigeria, in all the 3 tiers of government, that is local government, state, and federal government, they normally pay more emphasis on crop extension workers, neglecting livestock extension workers. Then the second challenge is poor logistics support for livestock field staff, such as community animal health workers. They don't have much logistics. Sometimes if there is a problem, they used to trek, or they take a motorcycle to go and report disease. Ineffective research extension linkages. Most of these community animal health workers, they don't have linkage to our research institutions, such as NVRI. Number 4, insufficient and inappropriate technologies. So that is because of that lack of linkage. They don't have insufficient, or there is insufficient or inappropriate agricultural technologies for livestock farmers. The last one is too much quackery. There are so many quacks in the profession, in community animal health workers. Some of them, they don't have any certificate, nothing. They just go around and treat animals where there are a lot of problems. But our community animal health workers, before we recruited them, we recruited people with national diplomas, higher national diplomas. Then also we gave them a training where they go and execute. Also, we register them with veterinary research council. Then solution. Funding should be provided to community animal health workers by government, NGOs, and private individuals. Number two, logistics to cows with motorcycles, motor vehicles, and so on, which will assist them in going around to make their operations, and also for proper monitoring. Because the officials, most of them, they don't have transport means, because what we did after we employed these community animal health workers, where each local government in the state has 5 representatives, 5 times 44, it will give you 220 community animals workers. So they are all in the state. So there is no much logistics where this representative of the ministry to go around and supervise the cows. The number 3, transforming livestock research extension linkages through cows. Most of, like this MVRLs, they're supposed to have a kind of linkage with these community animals health workers. If there is any new disease, or if there is anything on the field, they will take it to the research institutions. And if there is any change in the research institution, they will take it back to community animal health workers and take it to the directly to the farmers. Then number 4, there is need to make livestock technologies available. Through this link, the livestock technologies will be much more available. Then the last one, community animal health workers should be trained at regular intervals and register with professional bodies to avoid the problem of too much quackery in the job. Thanks to Ikore, last time they selected some of our community animal health workers and give them training, and we need more support from organizations like that, especially in good reporting system. Because if you look at our community animal health workers, our reporting system is not well documented. It's documented with the State Ministry of Agriculture through the livestock section. So if to say we will have good reporting system in our office, that is the case ADP, we can be able to document and keep record of all the diseases that are happening. And also we have good reporting system. These are some of the representatives during the training of case ADP community animal health workers. After the training, we give them the starter pack, and also so many support was given by the project. Thank you very much, and thank you for listening.
Thank you very much, Dr. Garba, for your great presentation. It's good to see all these efforts to integrate community animal health workers in disease surveillance coming from different projects and working together. So now we have some time for questions. I think there were some questions in the chat. Here, maybe, I don't know, Jesus Tommy, if you can tell me.
Thank you, Arno. Thanks for the moderation. Yeah, the first question here is there interoperability between the LIDISKI reporting tool and the NADIS tool?
Yeah, so if I may answer that, basically, I think it's Ashimi Yusuf that actually asked that question. So presently, there is nothing like that, but we are looking, I've been engaging with FMAD on possibility of doing that, having a meeting with them, because we've had some engagement recently. So, and we are possibly looking forward to that as we move on with the project. Thank you.
Yes, if I can complete, indeed, one of the objectives of the project is working with FMAR to kind of propose a tool for the veterinary services where all the disease reporting coming from the community animal health workers would go in and would be accessible from FMAR, and it would integrate other tools like the one already in place with NADIS. So indeed, it's part of the objectives really to make something that it's usable and integrated with the efforts already in place by FMART. Next question, to me.
Okay, so someone is also asking, any special provision for communities that are affected with insurgency?
I think presently we are working in 3 states, which is Kano, Plateau State, and Bauchi State. And that is where we are presently, but we don't know what can happen after the project. I think Arnold may want to shed more light on that.
Yes, really. I mean, now we are reaching the last kind of year of the project, and one of our very key output coming for next year will be to work with the different stakeholders and notably with the ministry to provide recommendations based on the impact of the different activities of the project to really show what has been working and ready to have recommendation of what could be scaled up to other regions in Nigeria, to all the states in Nigeria. Of course, for every state, you're going to have like its specific local context and problematics. And of course, in communities where you have more difficulties, there's going to be, of course, something to take into account. But especially, I think in places that are hard to reach, community animal health workers are definitely a solution, because that's where veterinary services maybe have more difficulties in getting themselves. But of course, this will have to be discussed for future activities.
Okay, thank you, Anna. Another question here. It says, with the present economic challenge in Africa, most especially in Nigeria, how sustainable is the cows project in aspect of meeting the recurrent needs and other overhead costs?
Okay.
So kit, maintenance, publicity, awareness, and program costs. Yes.
Yeah, okay. I think that question was asked by Tosin, right?
Tosin, yes.
Yeah, so majorly, the Community Animal Workers Program is a self-sustaining program. It is self-sustaining. How? Because there is exchange of money. There is demand and supply. There is demand for the community animal workers service in the rural community, and the farmers are willing to pay for the services of this community animal worker. So therefore, the community animal worker is self-sustaining. There is no need for anybody to give them money, salary, or no, there is no need. The major thing for us that we are majorly concerned is the aspect of disease reporting. Because take it or leave it, we've trained over 130 community animal workers. There is 100% of this community animal workers still on the field working. You don't want to see the amount of engagement that we have every day, that our state managers have every day with these community animal workers on the field. They are involved in a lot of activities on the field. So it is self-sustaining. They are making money on the field because it is in the rural communities that these animals are, and the farmers have no access to the community, to veterinary services. And when they have access to it, they are willing to go to every end to protect their animal, because their animal is their source of livelihood. Thank you.
Dr. Garba, did you want to add something on this?
Yes. what I want to add on this, these community animal health workers, is a very sustainable project, because like in Kano, we bought a lot of drugs and gave it to them, a lot of equipment, and this equipment and drugs, they are selling it to farmers directly at cheaper rates. And also, when they sell it, they go to market and buy another one, and also go to the farmers. So it's self-sustaining. There is no need for anything, because these kids, they take it as their livelihoods, most of them, and they are making it very well, because we normally go around and see how they are performing, and also we get a report from the State Ministry of Agriculture on the way the health workers are working, and also we are hearing from the farmers. They are making it, so it's self-sustaining. Even some of them, they are teaching their younger ones in this activity. Thank you.
Yes, thank you, Dr. Garba. Of course, for the part of the disease reporting, that's where also, as Banga was saying, incentive in seeing the link directly with the state veterinary, the local vets, seeing that their reports is leading to some action from the veterinary services will be also important in kind of incentive in continuing doing this disease reporting, because if they see that it does matter, and then it can also bring, of course, more opportunity for them also to provide vaccination and other medicine as well. But really, like, making the link between the report they send and having like a feedback from that will be very important to keep that sustainable. Please, Jesus, to me.
Okay, so the last question here, someone is asking for the qualification, the highest qualification for a cow to be selected. So yeah.
Now,
to my project,
okay, Doc, would you like to go first?
To my project, KSADP, the qualification is a national diploma in animal health or higher national diploma. So the minimum qualification is at least national diploma. Then we give them training and equipment. Thank you.
Once again, so the selection criteria for the community animal worker is also based on VCN criteria, because when you go through the VCN curriculum, because VCN has a material that they use for training community animal workers across the country. So the criteria is at the back of that curriculum, and that is what the state used in engaging selecting the community animal worker. However, a community animal worker must be based in the rural communities that is being selected from. A community animal health worker must be able to read and write, because the training is not just ordinary training. You must be able to read, you must be able to answer questions, because you will be the community animal workers will be assessed. So, and then you must have basic knowledge of animal health management. So that means this actually spurs interest in providing services for farmers. So basically, those are the basic qualifications. You don't have to have maybe university or maybe higher diploma, no. But then you must be able to have all these simple qualifications, especially at least most of the time, always ND or AND to act in animal health to actually have to actually be qualified to provide these services. And you must be resident in the rural community. Thank you.
Thank you,
Dr. Banga.
I think we have a hand raised by Paulina Thomas. If you want to take the floor, if you have a question you wanted to ask. See, Miss Paulina Thomas. Well, it seems no. So maybe was there another question on the in the chat, Jesus to me?
Okay, so someone is asking, must the diploma be based on animals? So based on the hello.
Yes.
Okay.
Hello.
Yeah.
So what was the question? Sorry.
It says, must the diploma be based on animals?
Yeah, so now we are not the one doing the selection. VCN have is a document that is being stated. It is now if it is also based on our feedback from the field that okay, we can do this. Let us if VCN can revise. So it is not based on us, but majorly that is how VCN wants to start it, because you know this is a new program for VCN, and they want to do things as perfect as possible. But we don't know for future sake. But you know it is important for you to have that basic knowledge of animal, or have the love of animal before you can do this. It's not an easy task to go through just 3 weeks of assessment, 3 weeks of training, and then come out that you want to know. It is not easy to handle animal. And I think these are some of the reasons the selection criteria was based on that. Thank you.
The reason why diploma is cited in our project, it was contained in our project appraisal document part. Our part, that is KSADP part, said any person that will be a KSADP community animal health worker must have at least national diploma. And this is to make sure that the community animals health workers met the standard, international standard. And also it will help to reduce our competition, because we have a teeming population of youth that doesn't have work. So a lot of people came and tried to be community animal health workers, but we use that criteria of diploma before somebody is being selected. And also that is why we said 5 from each local government. So the position was shared equally to all the local government areas in the state. That is, each local government has 5 representatives from different localities. So that is why I quoted diploma in my slides. Thank you.
Thank you. There was a quick question here. Maybe you can provide both of you a quick answer. There was so please kindly provide us with contact support for the community animal health workers. So how could anybody here in Nigeria, in Kano and Bauchi, etc., know where are the community animal health workers and contact them?
Pardon? I didn't hear. What did you? Please repeat the question.
So people are interested in knowing how to contact the community animal health workers. So where could they find information about the contact details of the community animal health workers?
This is a very good question. Most of these community animal health workers, whenever you go to any veterinary clinic in Kano and ask for a local community animal health worker, they have their contact. So they are free, and they are all scattered in the state. And also they are attached to Kano State Ministry of Agriculture and Natural Resources through the veterinary section. So they are available. Anytime you wish to see any one of them, you can go to the veterinary section. They will give you their numbers and you can contact them, because all of them, they are online. They have their cell phones. And whenever you call them within their locality, they will go and attend to your problem. Thank you.
Okay, thank you. I see also, Banga, do you have more information on your side?
Yeah, so I think that goes for the other states where it is being implemented. Once you reach out to the state, the Department of Veterinary Services, in fact, any state vet where the community animal workers program is being implemented, they will tell you where the community animal workers are because they have their contact, they have their details, and they are the one in charge of the program in the state.
All right, okay, thank you. So I have another comment or question here about the fact that we need to look critically on how these workers are discharging their duties, knowing that they are not veterinarians. What preparedness are we making as veterinarians to safeguard indiscriminate use of drugs? Maybe here, Banga, you can provide first answer. Or
okay.
So if I may come in, the first thing is that there are certain topical questions, diseases that the VCN I marked that the major diseases that are very important in the rural communities. And these community animal health workers have been properly trained to manage these diseases. Albeit, if there are cases that they can't handle, which VCN have also highlighted, they refer to their supervisor. This is why the supervisor is very critical. Supervision is very critical, and as you say, the program is owned by VCN. However, it is implemented by the state, and it is the state that manage the affairs of the community animal worker. So that is why we say the state needs to own it and ensure they work with the supervisor to ensure that the community animal workers are doing what they are supposed to be doing. And with regards to misuse of drugs, no. The community animal workers, as I said, they've been trained on particular diseases and they are limited to these diseases. And their supervisors are aware of all the activities that they are doing on the field. Thank you.
Garba, you wanted to add something?
Can I continue?
Yes, please.
Okay, what we did in Kano, we have 5 zonal veterinary offices in the state. What we did after the training and equipping the community animal health workers, we handed them over to the Kano State Ministry of Agriculture under the veterinary services. So each and every community animal health worker is attached with a veterinary doctor. They are working in their communities. Whenever they see anything which is beyond their capacity, they used to contact their veterinary doctor. That is local veterinarian, from veterinary doctor in their local government area to the zonal veterinary office. So in Kano State, we have veterinary officers or doctors in each local government, and also we have veterinary doctors in the zonal office. So at each and every local government, there is a veterinary doctor. And those community animal health workers are attached to those veterinary local government area that is in their respective veterinary local veterinary office. So anything they have which is beyond their capacity, they contacted the veterinary doctor. That's why we said in any disease that is need attention of the state, they normally report it to that veterinary doctor. From there to the zonal veterinary office, from the zonal veterinary office to the State Ministry of Agriculture. So that is how we are operating. Thank you.
Okay, thank you. I think we'll just look at maybe the last 2 questions before closing remarks. There was an interesting suggestion. There there is a need to bring the community animal health workers together to form associations for them, like Nigeria Association of Community Animal Health Workers, for example, and if possible, register this association. Like this, the cows will know themselves and then get support from partners and governments. What's your view on this, Dr. Garba?
Thank you very much. Like our community animal health workers, they have a WhatsApp group. And in that WhatsApp group is purely professional. Whenever there is a disease, sometimes they used to share it. If maybe an animal gets wounded or any issue, they used to share it among the group. I am the manager of that group. So whensoever I see anything that is not professional, I used to remove it from the group. But that group is very important. If a project like Fore or LIDISKI can assist in making these community animal health workers a kind of association, it is a very welcome idea, so that they will know each themselves very well, because our WhatsApp group is mainly KSADP community animal health workers. But I know there are so many community animal health workers in Kano State that are trained by Red Cross and other organizations. And there are some that they don't have any affiliation with any NGO or anything. They are on their own. So if we can have an registered association, it will assist a lot, because they can even go into cooperative society, maybe by having a veterinary drug shop where they can be buying very genuine drugs at affordable price. Maybe it can be situated in all the 44 local government area. So the only thing is a support, because my project has a lot of activities. Community animal health workers is just a small portion of my activity in the project. So if some of your project can assist in this, it's a good idea. Thank you very much.
Okay, thank you. Shezutomi, I think there was an interest in hearing someone about the impact of the community animal health worker work. Please, can you take the floor on this?
Okay, thank you, Arnold. I don't know if we still have Dr. Harrison in the meeting. Dr. Harrison, would you like to unmute and share your experience? Dr. Harrison Dilly from Adamawa State. Okay. I think he's not available. Dr. Emmanuel. Dr. Emmanuel Keida. Can you please unmute? Okay. It seems they've been logged out. So in the absence of any of them, yes, can continue.
Okay. Well, maybe I'll look into if there's a last question. If they are back, please let me know. All right. Continuous training. I'm looking into the questions. If there was another question I'm missing.
Okay. Paul Thomas eventually asked the question. He wants a soft copy of the presentation. Yes, we will reach out to you.
So I think the presentation will be made available through either the website or the means, and then the recording of this webinar will also be put on our YouTube channel. I think, just to me, you can put the link of the YouTube channel maybe in the chat.
Okay.
All right. Any last comment?
Okay, someone is asking how it can be brought down to other states.
Yes, of course, this is now and a main question. I mean, here, as Dr. Garba and Dr. Banga have said, we are working on specific states. For Dr. Garba is in Kano, and then we are working in 2 other states. And really, what we want is to bring all this information about the great impact that having community animal health workers can have for disease surveillance and disease reporting, bring that to government and funding institutes so that this can be scaled up to other states as well. So next year will be the time when we bring all the results of the project and make recommendations, and hopefully based on those recommendations, decisions can be taken at governmental level, but also at when priorities have to be given to funding opportunities, so that there's more funding to increase the network of community animal health workers across Nigeria. I don't know if Dr. Garba or Banga, you wanted to add something, Dr. Garba?
The only thing I can say is that we are calling on these NGOs to assist these community animal health workers in making them more effective, because they are doing their best in performing in making their duties, because most of these localities, they don't have any available veterinarians. It's only the community animal health workers. And I'm still appealing, if possible, let's make them into association or cooperative society, which they can give more impact to the common farmer. Thank you.
All right. Okay, thank you very much. Manga, did you want to add something before I close the meeting, the webinar?
So I think what I will just, thank you, Arnold. So what I will just add is that, so the major issue, the major thing is for the state to actually own the program and continuously work with this community animal health worker. We've implemented, not even only within the LIDISKI project, we've also implemented in places like Kaduna, Jigawa, and we've seen how efficient this community animal health workers are. And so it is important that, however, it is important that the state actually own this program. That is the major thing, so that the community animal health workers don't stray away from their objective or the reasons why they are being implemented in the state. Thank you.
All right, thank you very much. So I think we will be closing here the webinar, this webinar for the LIDISKI project. So if you want to know more about the project, you can go on our website, also lidiski.org, and you will have also the YouTube channel where you can find this webinar and other webinars and other activities that were organized by the project, and more information about some of our activities. Indeed, I think it was a very important topic, showing that community animal health workers are key for livestock disease management, and there are still a lot of work to do for this to be really efficient and be integrated fully in animal health activities. And it's things that we will be hopefully be able to bring some some improvement and solutions with this project and the project proposed by Dr. Garba as well. So thanks again to Dr. Garba and Dr. Banga for their presentations, and to Jesitomi for organizing this webinar. Please do subscribe to our newsletter if you want to know more about our activities and what's coming up during the next year for this project. For now, thank you very much and have a good day. And we'll hopefully see you again for the activities. Thank you. Goodbye, everybody.
Thank you.
Thank you, everyone. Bye.
Dr. Ario, thank you, sir.
Thank you, sir. We really appreciate and enjoy this.
So thank you very much.
Thank you.
Thank you.
Bye-bye. Thank you. This is a program, this is a development idea. Thank you very much. Thank you. It's a good idea. This is development is a program. It's very, very happy. Very, 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 very good. Thank you. It's very happy, Dr. Garba.